Hey everybody, it's Chris from chrisbeatcancer, and today my guest is Marcelle Pick. Marcelle is an integrative OBGYN nurse practitioner and a pediatric nurse practitioner. She co-founded the Women to Women Clinic in Maine in 1983 with a vision to change women's healthcare. In her practice, she takes an integrative approach which not only treats disease, but also helps women make choices in their lives to prevent disease. Marcelle serves on the advisory board for the Integrated Healthcare Symposium, as well as the renowned Hoffman Institute. She has served as medical advisor to Healthy Living magazine. She writes a bi-monthly newsletter from Women to Women and lectures on a variety of topics, including weight loss, resistance, infertility, stress, illness, and adrenal dysfunction. Marcelle is the author of 3 books: The Core Balanced Diet, Is It Me or My Adrenals, and Is It Me or My Hormones? So, hi, Marcelle.
Hi.
Welcome. Thank you for doing this interview.
Absolutely.
So I should say that Marcelle and I met at a conference a month ago, basically, and I believe it was our mutual friend, Robin, Green Smoothie Girl. And as Marcelle and I were chatting, and I was talking about, what I do and stuff, and then she was talking about what she did, she started to tell me this really incredible story. And I was like, hey, can I interview you? So here we are. So the first thing I'd like to ask you about is 1983. I mean, you started a clinic, a women's health clinic, but from the very beginning, I guess, had more of an integrative approach to taking care of women. And so where did that come from?
It's interesting. I grew up in Australia in the outback, and I spent a lot of my younger years quiet by myself in the Aboriginal caves or with a girlfriend. We didn't have cars. We didn't have kind of the luxuries. We didn't have TV. I didn't know how to flush a toilet until I was 11. So it was a very basic lifestyle that was very connected to the earth. And from a very, very young age, I've always known I wanted to do things a little differently in healthcare. Where did that come from? I have no idea. And when I came to America, and I was 11 when we came to America, I was very committed to kind of either going medicine route or nursing route, and became then a nurse practitioner. So I grew up with Edgar Casey. My mother used to have some unusual experiences in our home. So I've always known that there was another model besides always going the conventional route for treating disease. And I became very interested in Dr. Jeffrey Bland and started looking at biochemistry. I'm a little bit of a geek, so I like to kind of know the science, and started to see that there's a way for us to know scientifically what we need to do upstream. How do we need to treat things before they're even a problem? So I started the holistic, I was in part of a holistic center in 1981, and we started Women to Women in 1983. And the notion of that was, how do I help women understand that they can be their own personal advisor with regards to their own health? That what we have now is a culture in which we tell people what to do, and they have to kind of take our dictate because we know more. That doesn't work from my perspective. And what we have now in America is horrible chronic diseases in which nobody's getting better. And they're on more and more medications with more and more side effects. And then we're not really getting to the root cause. Even if you see people in your practice, or I do, with MS, their symptoms are different. They're not even the same symptoms. So just treating MS in the same way doesn't make any sense to me. It's looking at, how does food play into this? How does stress play into this? What's happening to the biochemistry? And for me, functional medicine was my tool of being able to do that. So from the very beginning of Women to Women, we used nutrients. We were not ever using Prempro, which was at the time in 85, it was almost malpractice not to prescribe hormones for women when they went into menopause. So we always used bioidentical formulations that we actually compounded, and back then it was really hard to do because no one was doing it.
Yeah, I can imagine.
So we always had this sense that there was another way we needed to engage our customers or our patients into their own healthcare. And we were in the area the only all-women's practice. It had never happened before in Maine that would be an all-women's practice, much less people that were physicians and nurse practitioners of equal practice. So we were huge at the time, and everyone in the community was saying, no one's going to go to you, they're not going to pay attention. And we were one of the fastest growing practices in Maine. And we're still there. We've been there for 30 years. Chris Northrup has moved on, and she's now writing a lot of books and doing incredible touring around the country, really teaching people about this notion about how do you do self-care. So I've been interested and involved in this world for a long time. It doesn't make sense to me to always use drugs as an endpoint for treatment. There are some, I use antibiotics, certainly use drugs when I need to, but I'm always looking at what else do I need to do? What went wrong in the system that's engaged other problems that we need to interfere with? So for me, functional medicine or integrative medicine is the only answer to that question.
I obviously interact with a lot of cancer patients, and what I experienced in my own health journey, and what I hear over and over and see happening over and over, is that something that you mentioned, which is that the patient goes to the doctor, a person goes to the doctor, and more often than not, they're not given any tools to go home and change their life. There isn't even a conversation about how are you living? Like, what does your life look like? What does your diet look like? Tell me about your work. Tell me about your stress. So none of those conversations are happening. And what essentially happens is the patient gives all of their power to the doctor or practitioner or whoever. And the practitioner says, you're sick, but it's nothing you did. You had nothing to do with it. It's just either bad luck or bad genes. Therefore, because nothing you did contributed to your situation, nothing you do can make any difference. So you just go home and keep living the life you're living, and we'll we'll do the best we can for you.
So the piece about that that's so horrible is that we have tons of science to show that that's not the case. We know now more than we ever have before that even with using hardcore interventions with chemotherapy, that we're not becoming gene specific enough to make a difference. And that we're imagining all ovarian cancers, all breast cancers as being the same. Even within the archetype of invasive ductal breast cancer, there are still separate genetic expressions that we need to be paying attention to. So it makes a huge difference to make a dietary change. It makes a huge difference. Sugar is one of the most problematic foods that we have when you have cancer. Cancer and sugar love each other. So getting rid of cancer, using more of a paleo, where there's lower grains, lower complex carbohydrates, adding nutrients to a foundation of an immune system is crucial. Doing acupuncture can make a huge difference. So it's so wrong what we're telling people is that what their lifestyle is doesn't make a difference. We also know that stressors in our lives cause gigantic problems. I've become fascinated by something called the ACE study. And the ACE study was done many, many years ago, 1998. And what they did is they looked at 19,000 middle-class Americans through Kaiser Permanente and the CDC. And they looked to see if they had adverse events. We're talking in their childhood. On a score of 1 to 10, if they had 4 of the events or more, their incidence of heart disease was 200% higher. Their incidence of suicide, 1,200% higher. Addiction, lung disease, kidney disease, early retirement, and early death. So if we think for one moment that stress is not impacting our physiology and increasing the risk of cancer, we're crazy, because it's absolutely not true. And we're talking science, we're not talking New Age medicine,
right?
Talking what we see from doing studies. But it's not mainstream medicine. No one even knows about this study. It's the longest ongoing study in the history of medicine. It's like we get blinders on, and we're like, no, that's not part of the puzzle. Just do it this way. It doesn't work.
When I ask, one of the most important questions I think every cancer patient needs to ask themselves, and what I ask them when I interact with them one-on-one is I say, why do you think you have cancer? And the answer I always get, or one of the answers, right, is always stress. So patients know, right, before they even talk to their doctor, and they know that stress is a factor in their life. And, they always say, well, I've been under a lot of stress. I'm in this really difficult marriage or relationship. I lost my business. I was in a lawsuit. I death of a loved one. All of those things, right? or my work, I've just got this really terrible job, and I'm in this abusive work situation for years. And sometimes it's like, A, B, C, and D, right? They've got these compounding stressful factors in their life, not to mention the guilt or the bitterness that they're carrying from stuff in their past. So every patient is telling me that they have these problems, right? That they know all these stresses in their life, and yet when they go to the doctor, they they'll even say, "Do you think stress, had something to do with it?" And the doctor's like, "No, stress doesn't have anything to do with it." I mean, this happens over and over and over again in these conversations, like I said a minute ago, where, the physician is just telling them, nothing in your life has affected you, right? And it's just random chance and bad luck. So it's so refreshing anytime I meet someone that's a healthcare professional that that understands the role that our diet and our environment and our choices make, right, in our health.
The tricky part, because I remember when I was diagnosed with cancer, the tricky part is to not get into this place of self-blame. That's
right.
So instead, to come from a place of proactive, I'm going to make some changes I didn't realize. And a lot of times people don't acknowledge in medicine at all that stress plays any part in anything they're doing. And I'm getting ready. I teach at the Institute of Functional Medicine, and next week I'm doing a presentation, a keynote on adrenal dysfunction. And the science is so ever present. And the American Endocrinology Society came out with a position statement in 2009 saying basically there is no such thing as adrenal fatigue. And they are so missing the boat when you look at the science to support the fact that there's major biochemical changes that are occurring with everyday stress. If you have too much cortisol, it affects our thyroid, it affects our hormones, it affects our digestion, it especially affects our immune system. Yeah. And people are just not seeing that. And we have the research papers in peer-reviewed journals, if we want to go down that road, to show that we absolutely see changes that happen biochemically because of stress. Now, is that the only thing? Absolutely not. Do you now have perhaps a genetic SNP that makes you more predisposed to breast cancer or to other cancers, in addition to pesticides, in addition to an immune system that's not able to tolerate it, in addition to stress and too much sugar? All of those factors are a piece of the puzzle. And I don't know that we're ever going to find a cure for cancer, because I don't think it's one thing that absolutely does it. Even with HPV, which is human papillomavirus, that we know contributes and is one of the major causes of cervical cancer, we know that as you change your diet, and as you add B vitamins, and as you add something called sulforaphanes, which is DIM or indole-3-carbinol, that in and of itself helps that genetic expression.
And we should mention sulforaphanes are in cruciferous vegetables.
Broccoli and
cauliflower, kale, yeah.
Absolutely. So it plays a part in it, no question about it, but it's many of these things. So it's understanding one's vulnerability biochemically and making those changes. And medicine is not doing it. Very, very few people that are oncologists are saying to people, let's look at all of it. Let's look at your lifestyle. What do we need to do to help you kind of look at that stressor in your life, that bad marriage? Why are you in it? And how do you learn to say no? Those are all the parts that are hugely important from my perspective in dealing with my patients, because it's there.
It's there. And I can tell you, I was a very stressed out, unhappy guy when I was diagnosed with cancer at 26, which is, super young and crazy, colon cancer at 26. And, but yeah, you touched on this earlier, and I just would like to affirm the point you made is, the point is not to blame someone for their own cancer. But when I looked at my situation, and I did some reading and read some books by people that had healed, and their perspectives encouraged me to say, hey, okay, you know what? I'm willing to take a hard look at my life, everything I'm doing, and say, you know what, maybe it's my fault, right? Maybe it is. If so, what can I do to change, right? Let's just look at everything I'm doing, the way I'm living, and let's change it all and see what happens, right? Because I had this, light bulb or epiphany that, wow, if these, natural health people are correct, then I'm living a very unhealthy diet and lifestyle, and my negativity and insecurities and bitterness and just all the stuff that was circulating in my head was hurting me, then man, I've got a lot of room for improvement, which was actually encouraging and empowering.
Hands down. And the part of that that gets difficult for some people that I work with is, I'm doing all you told me to do, Marcelle, and it's not changing. That's the part that gets into double-edged sword. But generally speaking, most everyone that makes changes, even if the cancer doesn't change, they change.
Mm-hmm.
Their perspective, the way they live their life, the enjoyment, the excitement, their whole way of being in the world is different.
Yeah.
And it makes a gigantic difference in one's source of happiness as well, because you're getting to the core pieces about the bitterness, the anger, the rage, the horrible sense of waking up in the morning feeling terrible physically because you're eating so much sugar. All those things shift, and people feel a very different lifestyle.
And I should mention, and I'm sure you agree with this, because you mentioned sugar just now. You could make the case, and I do make the case, right, that stress is the root cause of most disease, because stress leads us to self-medicate, right? So it leads us to eat a really terrible diet because we medicate with food. It leads us to smoke. It leads us to alcohol abuse and even prescription drug abuse. And although the medical community will never, ever admit this, this is what I believe.
But you know what's so interesting is, if you look at the ACE study, we have the proof that what you're saying is correct. Because the higher, and that's why I love this study so much, the higher the incidence, and we're talking middle class America, if we add poverty to that, about 35% of the population has high ACE scores. If we add poverty to that, 50% do. So what does that mean in terms of our health care that's related to childhood stress? Is gigantic.
Yeah.
And we know that that correlation is there, and I completely agree with you, 100%, that stress and understanding the root causes of that, if we looked at that early on in childhood, it would make a huge difference for the chronic illness that we have in our country.
Forgiveness. Oh, go ahead.
No, you go ahead.
I was just going to say, forgiveness was really huge for me, and it's something that I encourage cancer patients to do every time we talk, because forgiveness is letting go of the people that have hurt you, like letting go of the hurt and choosing not to hold it against them. And it's incredible the kind of feedback I get from people after they just take my advice and forgive, which is free. It's free advice and it doesn't cost anything to do it. And just how much of a weight is lifted and how much peace and joy come back into their life when they just decide to let go.
What's interesting is that any of those emotions that we carry in us on a regular basis, anger, despair, rage, and I oftentimes will have some of my patients get baseball bats or some of the wiffle ball bats. And if they're feeling any anger, just hit the bloody pillow. I mean, to get that out.
Yeah.
And then to move on to the whole notion of, it's not my fault. I didn't know any better, and I'm going to move on to a different direction. Sometimes it takes more than that, but it's the understanding that what was there, and sometimes it's having to do work on bringing up that 3-year-old that still feels not enough or not this or not that.
Yeah.
Bring her up to be a teenager or an adult to kind of move through life and said that was. And now I can walk through life with a very different attitude, which is huge because it's all related to what we're talking about.
Yeah, your attitude and your choices and your emotions, they're all, and your physical health, it's all interconnected. And I had to do a lot of work on just the way I think, right? Because we can be so negative. I just conditioned my brain to be negative, to be critical and judgmental, and to look for flaws, be a fault finder, right? And be jealous and envious. So I was constantly dwelling in negativity, and it took a deliberate, I'd say, let me rephrase that. It took deliberate, persistent, effort for me to catch myself thinking that way, and then say, wait a minute, I'm thinking negatively. I'm going to stop thinking that way. right? And so it didn't do it overnight. It was just a process of just daily trying to catch myself in those thought patterns and change them. But the reason I'm saying that or sharing this is because it can be done. You
Hands
don't
down.
have to be a negative person.
Hands down. There's two little areas on top of the brain called the amygdala, and that's the primitive brain. And the primitive brain is the childhood response to, uh-oh, I need to run away. And it's meant to be there, so we really pay attention and we do things to protect ourselves. The problem is, as we come from that response as adults, we get into that negative pattern. Oh, they're going to hurt me, or they're going to... But it's using the front part of the brain. It's called the neocortex, the rational part of the brain. And that's the practice you're talking about is, how do I practice? How do I push pause and go, oops, that's how I used to think. And now I think this way. Or, oh yeah, I see I'm doing it. Or having friends remind you, or having something on your new app on your phone to remember, did you do gratitude today? Those are the things that take practice, and you're so right, because that changes our biochemistry.
Yeah, it's like a muscle. You have to exercise it. And we're talking about is mindfulness. And a lot of people hear that term and are like, mindfulness, what does that even mean? But to me, what it means is mindfulness is thinking about your thoughts, like being aware of your thoughts and not just letting your thoughts just kind of run wild and your emotions run wild, and really catching and evaluating how you think and respond just throughout the day and throughout your life. And then thinking about, is that a good response? Is that the way I want to be? And if not, then okay, I can choose to believe the best about someone, even though they're giving me a reason to think they're the worst person in the world, right? I'm going to choose to believe the best about them instead. And it's tough, right? It's a challenge for sure. Something else I want to ask you what you thought about is, I have read and noticed that this is documented that many cancer patients develop PTSD after their diagnosis, because the diagnosis itself is so traumatic emotionally, right? That they develop symptoms of PTSD, immunosuppression, depression, emotional depression, and even an increase in metastasis in some cases just after the diagnosis.
So what's interesting about that is that the way the culture is now is that when we sit down with someone, there's I hate to tell you this, but this is what's going on. You need to do this, 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 and this. There's no, oftentimes in the appointment, connection of, how is this for you? And really doing heart to heart.
Yeah.
There's probably a lot of reasons for that, and one of them is if they're doing it all day long, you can't. It's kind of hard to do that. But the other part is that we oftentimes in medicine see people as numbers as opposed to individuals. And all of those things are horrible, because in the way medicine is now, the big C word is how it's kind of categorized. And then you go through chemotherapy and radiation, you kind of do these steps many times because you're supposed to, and then you don't ever get a chance to breathe and say, oh my God, what just happened to me?
Yeah. Well, because you're rushed in.
You are.
Right? As a patient, you're rushed in so fast, you don't even have time. I was rushed into surgery. I mean, they were trying to get me into surgery like the next day, which I ended up waiting a week. But that's still fast, right? And many patients are rushed into chemo or surgery or radiation therapy. Yeah, but just within days of their diagnosis, they don't have time to process like what happened. And and then, all this treatment happens, and then they're just, like you said, they're like, what just happened to me?
Right. And then the huge fear of, well, we've got to wait 2 weeks, so we've got to wait for your biopsy report. And then we've got to wait for the chemo, and then we got to figure out the oncologist. And it's terrifying for people because they're feeling so incredibly vulnerable.
And the term for it, whoever created it is a genius, cancer patient, I'm sure, but scanxiety.
Right, no question. And then they can't even figure out what should they do? What's that going to do if they do this chemo? Is it going to increase the risk of other problems later? And if they do radiation, then they can't do it if they have breast cancer and that breast again, and where does that all go? And it's terrifying for people because we don't have this mechanism of being able to say, look, let's kind of slow this down a little bit. Let's really make some decisions. Have somebody come with you that's a note taker who can really then make some decisions. Perhaps get a second opinion so you have another opinion about what you should do, and slow the process down so that people cannot feel so panicked,
Yeah.
which increases epinephrine and norepinephrine, which increases adrenal dysfunction, which
Yep.
makes you go down this road of, oh my God, I don't know how to put the brakes on.
I had an adrenal test done right after my surgery, and when I was starting to work with an integrative practitioner. And yeah, my adrenals were just shot. I mean, it was like whatever measurement the test was using, I was like in really bad shape. And so you mentioned this at the beginning of our interview about how important adrenal function is and how it plays a big role in the body, and how some practitioners don't even think it matters. But yeah, I had mine tested and I was just in adrenal burnout for sure. So you have a really fascinating story about your own breast cancer experience that you've never really told publicly, right?
I have never told publicly. No one, a few friends know.
So this is like the exclusive here.
This is the exclusive.
I can't wait. I know it, but I can't wait for you to tell it.
So I was doing a presentation, keynote on self-esteem. And it was a very kind of precarious situation in which I was doing this presentation. And I just went like this. And I was going off stage and went, oh my God. And one of my friends is a breast surgeon, and so we got in for a mammogram and an ultrasound that same day. The mammogram was negative, and the ultrasound showed a breast mass. And we aspirated it actually that day, and it came back on Friday as invasive ductal.
Mm. It's interesting that you felt it, but the mammogram didn't find it?
Fortunately, yeah. If you knew where it was, you could kind of find it on the mammogram if you had to, but it would have been probably as normal.
Yeah, okay.
And, that begs the whole question about mammograms now, as we know that they're very controversial, unfortunately, at this time, because they aren't as wonderful as we expected them to be.
I want you to talk about that. Let's come back to that.
So we then did the biopsy, came back invasive ductal, and then my daughter was graduating from high school, to wait. I didn't want to do it before her graduation. So she graduated, and then I had the biopsy, and they took a sentinel node. And I had a very rare form of invasive ductal called tubular. And tubular is a type of cancer that's very, very slow growing. And at that point, I made a decision personally that I was not going to see an oncologist, and that I was not going to see a radiologist. I knew what was going to be recommended for me was probably radiation. Mm-hmm. And probably also tamoxifen, because it was estrogen and progesterone receptor positive. Because I know as much as I do, I did not think that I would be able to protect myself well enough when I went into those appointments, and I would be so fear-based that I decided that I would change my body in such a way that it didn't recognize it anymore.
That's amazing. That's such an amazing point you made. Let me interrupt, because it's why I say it's amazing to me is that you, being a practitioner in the industry with a vast knowledge of, let's say, integrative and functional medicine and holistic health practices, still didn't feel or were, how do I say this? You were wary of, even with all of your credentials and like ammunition, of still being sucked into a fear-based decision, right? And I mean, and hearing you say that surprises me, because, and I know it's true, I mean, but that's just a statement to how powerful the fear is in oncology centers. I mean, I call them fear factories, but I mean, for the average person that doesn't know squat, right? I mean, they're going in there. I mean, this is basically, they're like going in there naked. You're going in there with armor on, and you're still like, I don't think I can make it in there.
But I knew enough that I didn't want to put myself in that position. And I had girlfriends with me, and they were just kind of my support network. And I was eating pretty cleanly at the time. I did organic. I brought my kids up on organic food. So I've been eating organically since I was probably in the 70s. So a long time. So it wasn't food that needed to change so much. It was really more my emotional outlook. And I was in a very abusive marriage, emotionally abusive marriage. Had been in it for a long time, wanted to stay in it for the kids and all the kind of the wrong reasons.
Understand.
And then made a decision that I just couldn't do that anymore. So a lot of changes were going on. I was in the middle of a horrible lawsuit with one of my patients had one of the tests was interpreted incorrectly by one of the nurses. So I was kind of in that piece of, oh my God, how do I shift this? And fear-based all around me. So it was very clear to me that I needed to make some decisions differently in my world of my intellect and my emotion. And at that time, I also went to the Hoffman Institute. I made a decision that I really wanted to do some more deep work around my childhood, which I'd spent most of my life doing. I've always been curious about how can I really better myself as a person? What do I need to know about my relationship to many different things? So I've always been a seeker of that, and I decided that year that I would do it as well. And that was also transformational for me about letting go, which is what you're talking about. Forgiveness, about moving on, about understanding that we are our parents oftentimes in terms of the patterns that we have, and how do we then not create relationships that are dysfunctional. So all of that was part of what I did for the work for that year. And then I made a bigger decision, and that is that I had an MRI afterwards, and I had, I think, one mammogram, maybe two mammograms, and that was 2008. So I do regular self-breast exams. I'm pretty conscientious about looking at hormone levels and using nutrients. And when I go out, I'm very careful about how I eat. My friends kind of laugh at me, but that's my stake in the ground of being kind of careful about, I don't do a lot of junk food and, no preservatives. And I'm very clean about sauces and no gluten in my diet. It's just what I'm choosing to do for myself.
Yeah. And so it's been 8 years, right?
Years.
Congratulations. No recurrence in 8 years is absolutely fantastic. And I mean, wow, what a crazy thing to, like, some of the things I mentioned, right? The, unhappy, difficult relationship, lawsuit, and that's what was happening to you in that time. And so for you, maybe there were some small improvements you made in your diet and lifestyle, maybe got a little more serious about some things, but you feel like it was the emotional and the stress and stuff that you did the most work on, right?
No question. And when women in particular, this is just my experience, are not really good about taking care of themselves. So they breastfeeding the world and forgetting themselves. And that's what I was doing. I was seeing patients all day. I had 3 kids. I was taking care of them. I was the breadwinner in the family. Went on and on it went. I had seldom time for myself. I didn't see my girlfriends. I didn't do those things. So it was the dance for me was finding out how do I take time for myself and have it be important enough as a mother to me so that I had enough energy to take care of my kids as well.
Can you talk a little bit more about some of the specific changes that you made?
I got divorced.
Okay.
But that took a while. I mean, it took time. It didn't happen right away. And I was clearer in the relationship and the marriage about how to do things a little bit differently. I was better about going out with girlfriends. I was more conscientious about exercise for myself. And I was trying to find avenues that I could advocate for myself a little bit better and not feel guilty. I also was much better about boundaries. How do I set clearer boundaries about, I don't think this is going to work for me. I appreciate what you're saying, but I don't think in this moment that's the best idea for me.
You started saying no.
Yeah. I mean, that's basically what I did. And I think that's for women in general. It's an ongoing problem because we're so able to do so many different things and multitask. Mm-hmm. And it's not well appreciated when we say no. I was on the board at the kids' school. I was doing all of their fundraising. I was doing, I had a practice. I was on call. I had kids. I mean, it was like ridiculous.
You're just going 90 miles an hour.
Right. So, did my adrenals look great? Not so much. So did I have to kind of rehab them? And do I still, to this day, have to do that? Absolutely. Because it's an ongoing, when you have a medical practice, it's an ongoing thing you have to pay attention to.
So let's talk about mammograms. And whatever you want to talk about related to the breast cancer industry, specifically overdiagnosis and overtreatment, all that kind of stuff.
Well, it gets tricky because, women are terrified. They don't want to get, breast cancer. And the interesting thing is that more women die of heart disease than they do of breast cancer. But the fear, and I think it has to do with us as women, this is part of our beauty, is our breasts. And it's how we nurture our children. It's how we kind of give in the world. So I can understand why women are so terrified of it. But the problem is that mammograms have been kind of put out there as the end-all answer for breast cancer. And what we found from a study that was done by the the Preventive Task Force, was that we should probably be doing mammograms at 50 every 2 years. And if you have a family history of breast cancer, i.e. a mother or a sibling, then you should do it sooner than that. And we then did not change the recommendations because the recommendations were still held at 40, start at 40 every year, and so on. There were some interesting studies found in Denmark and Sweden looking at, is there a relationship between more often having mammograms and more breast cancer? And it's still controversial because there may be an association with that, especially with DCIS. And in Europe, DCIS is not treated. So that's tissue-specific breast cancer without any kind of invasion versus, what we call invasive ductal. But here, we're very aggressive about treating DCIS, or more aggressive certainly than other countries. And then we came out with a very large study that was looking at 95,000 women over 25 years, showing that if you had a mammogram and if you did a breast exam, the mortality of those two was the same. Well, that gets a little tricky, and that gets tricky in that if you're diagnosed with breast cancer, it will probably find it sooner. But in the long run, the end result is no different. So what that's telling us is that the more aggressive breast cancers are not found on mammograms oftentimes, and they're more aggressive when we do find them on mammograms. And the same is true with breast lumps. But if you find a small lump, you may have found it earlier on a mammogram, but the treatment is still going to be the same, and you're still going to be able to be treated for that problem.
Which throws a wrench in the mammogram save lives sort of slogan, right?
Right. So, but it's very complicated because people then want to know what to do. Are thermograms as helpful? Does it really make a difference in that regard? So now we are in a situation, what do we say to women? So what I say to women in my practice is be more mindful of kind of checking out the breasts.
Mm-hmm.
Find out what's normal breast tissue for you. Make sure you're getting plenty of iodine in your diet. If you're iodine deficient, it absolutely affects breast tissue. If you have fibrocystic breast changes, begin to take evening primrose oil along with fish oil, along with the iodine in the form of seaweed or kelp flakes, so that really do look at that. The other thing that's really important is we know that there's genetic predispositions looking at, there's 3 different types of how we metabolize our estrogen, 2, 4, and 16 we call that. I call it the good, the bad, and the ugly in my last book. We can look at that and see if those ratios are off. What do we need to do to shift that dynamic to decrease one's risk of breast cancer? We also can do some genetic profiling with 23andMe to find out not if you're going to get breast cancer. That's not what it does. It looks at genetic SNPs to see, are you someone who's a pathological detoxifier? Are you someone that really wouldn't do well on hormones? And if you do hormones, then how do we really shift that dynamic by putting you on N-acetylcysteine or indole-3-carbinol or DIM? So we do know things to make a difference before we get so worried about breast cancer. So somebody may choose to do a mammogram every 2 years, which I'm going to be completely supportive of, whatever makes her feel well. But then we also need to do the other things that I'm talking about, which is the DIM, the indole-3-carbinol, to find out what your predisposition is. How much stress do you have in your life? And what are you going to do about it? Do you have a history of 4 or more on that ACE study, in which means you've got huge risks for many cancers? How do you shift that and that? All of those pieces are incredibly important, not just the mammogram.
Absolutely. I thought, I want to mention that for anybody that's, maybe this is all brand new, there's a field of science called epigenetics that studies gene expression. And so if you want to sort of boil down what the message of epigenetics is that your genes don't determine your fate. Your diet and lifestyle environment really determine your fate. And yes, you can have genetic predisposition and heredity and family history, but our choices matter, right?
hands down. You know, they've done studies recently also looking at Holocaust survivors and looking at the epigenetic changes that the Holocaust actually had in offspring.
Oh, whoa.
So now we're starting to say, oh my God, we know that that kind of stress in a parent is changing gene expression moving forward. So that's the most recent kind
Do you
of.
know some of the detail? This is fast. You're blowing my mind right now. Okay. Do you know some of the details? I'll probably look it up when we finish the interview, but
Yeah, I mean, I've got the articles in the other room because that's what I'm going to be writing my next book about, is
yeah.
that we think for one moment that those stories don't affect our genes, and I happen to be a Holocaust survivor. So, you know, I've got this amazing ability to be able to withstand unbelievable circumstances, but at what expense? You know?
Yeah.
So that there's all those pieces to the puzzle. So there's more and more research coming out, and the ACE study together with this is telling us that nutrigenomic, epigenetics, and looking at how we need to deal with our emotions are part of the key puzzle to this, so that we can change all kinds of things moving forward. It's not just that we're a victim then.
Right.
We have some ability to change our thinking, to change our environment, to change the kind of love and support that we have around us, as well as the nutrients that we use when we start to understand some of those genes. There's something very important. Remember when Angelina Jolie had her bilateral mastectomies?
I do. It was a big deal.
It was a very big deal. Well, what's interesting is if we look at how the BRCA gene was expressed in the population, it's called penetrance.
Okay.
In the 60s, what we saw is about 15% of people that had the BRCA gene actually got breast cancer. Today, the penetrance, i.e. those people that have a gene that get breast cancer, it's 85 to 90%. The gene didn't change. The epigenetics changed and the nutrigenomics changed. So the foods that we're eating, the thoughts that we have, the environment that we live in, those are the things that change. And now the gene is much more aggressive? Probably not. But it's now penetrating the population more.
Because all of those factors, our diet and lifestyle and environment, are affecting the gene expression. And essentially they're switching that gene on more than they were. When was the original, 50 years ago? Or
yes.
Yeah. And we all know the way we're living in the world is very different than the way our parents and ancestors lived in the world. But it's very encouraging at the same time, right? It's, to me, when I hear that stuff, it's encouraging because it just shows that, hey, you can change your genes. Like the Holocaust survivors, their genes changed as a result of, or the expression anyway, of that experience, but they passed that to their children. But even if you're a child of a survivor, your choices in your life, the way you live now, can change the way those inherited genes express, right? Am I summarizing that correctly?
And what it does is it empowers us once you start to take that position and that thinking. Because it means that you're no longer just a victim. You have something you can do to make a difference. And that's the unfortunate part we don't do in medicine. You know, we're not saying to people, you know what, 5 of your nodes were positive, but 10 weren't. That's all you needed. Let's get going here.
Right.
We don't do that. Instead, it's like, oh my God, we gotta kill this now. And it's a very different mentality, cup half full, cup half empty kind of concept.
You know what drives me crazy? I'm so glad you brought that up, because I hear reports from cancer patients who are adopting a nutritional protocol, alternative therapies. You know, maybe they've decided they don't want to do chemo at all, or maybe chemo didn't work for them or whatever. And I can't tell you how many times I've heard this, but they'll adopt a hardcore protocol, whatever it is, and you know, a few months will go by, and they'll go in for a scan or whatever, and let's say there's no change in the tumor, and the doctor will say, "See, what you're doing isn't working, because the tumor is still the same size." But the flip side of that is like, wait a minute, if the tumor's the same size, maybe you've stopped it, right? Maybe you're slowing it down, maybe you've stopped it. You know, there's a positive aspect to this too, like what you're doing may be working after all, like, you know, keep going.
Absolutely. But the part that's frustrating for many of us, and Jeff Bland had a symposium last year, and it was about the genetic expression of many different genes, including cancer genes, is that we're so fast to kind of blame. Well, in particular the conventional world is, see, it doesn't make a difference. Why does it make any difference? Well, we have the science to show that sugar is probably not the greatest choice. But if you have chemotherapy, go ahead and have a donut for breakfast. Are we crazy? I mean, it doesn't make any sense to do that because we know that that feeds the system. And if you're hungry and you're losing weight, let's find some really healthy choices for you that will make a difference. So unfortunately, medicine takes about 50 years to change. When I started, and we knew that Prempro was not a good choice.
Yeah.
That's 1983. So now finally we've kind of moved forward to say it's not the best option for you. We had the same thing with something called Helicobacter pylori that I was using.
H. pylori?
Yes, I was using a multitude of treatment options to get rid of it. No, it was stress-induced. Well, now we found out, no, H. pylori is what causes ulcers. So medicine takes a long, long time. But
and stomach cancer too, right?
Yes, and what they don't say along the way is, oops, we made a mistake, and we were wrong. It's always, nope, this is how it is, and we're right. Well, I don't think so. And we're going to find out later that there's things that we were wrong about. HPV is an example. We realize now that there's a viral component to many different kinds of mouth cancers, tonsil cancers as well. So we know that we can intervene nutritionally to make a difference because it's a virus. We all have exposure to viruses. What do we need to do with the immune system to make it less, susceptible?
Mm-hmm. Will you talk about, I believe was it the Women's Health Study that came out where they found a significant increase in risk of breast cancer, or maybe more than just breast cancer, from hormone replacement therapy?
Right. So there was not a significant increased risk, but there was an increased risk.
Okay.
They looked at 16,000 women, and they looked at those women, and they expected that they would see that hormone replacement therapy helped heart disease. Now, the interesting part to this is a lot of people don't know is many of those women had never been on hormones and hadn't been on hormones for 10 years and were 60 and put on hormones. But what they found was there was an increased risk of stroke, of blood clots, of heart disease, and breast cancer. When they pulled the progestin, which is not natural progesterone, but progestin out, they found that the women didn't have as much of a risk of breast cancer. But the interesting part is when you pull the study completely apart and you see those women that were menopausal on the hormones, the thing that they saw is that they had an increased risk of breast cancer, not significant in comparison to the other population. So it gets very confusing then. So what does this all mean? It means that using horse urine estrogen is probably not a good choice.
What? That's natural.
Progestins is probably not a good choice. Am I someone who's supportive of bioidentical hormones for some women? Absolutely. But I'm always looking at hormone levels, and I'm always looking at how that 2, 4, and 16 ratio is, and what kind of risk factors they have. So I'm always individualizing it for that person instead of hands down, this is it, this is how it is, which is what happened with this initiative. Hormones used to be the best thing since sliced bread, and now it's the devil incarnate. It's like, well, you can't have it both ways. So it's kind of interesting that medicine is not ever saying, oops, we made a mistake, and now we're kind of rethinking this. It's black or white.
I did notice, I thought it was interesting that in the years that followed that study's announcement, there was a significant drop, though, in the diagnosis rates of breast cancer.
Absolutely.
Yeah.
Absolutely. So we know that there's a relationship between estrogen and breast cancer. There's no question about that. What's happening now for many menopausal women is they're having hot flashes and night sweats. So now the treatment of choice is antidepressants because it helps with the hot flashes. So that's what's happening now is more and more people are on antidepressants to help with the hot flashes, which is like, wait a minute, there's something else going on here. Maybe it might be adrenal related.
Yeah. And so you feel like, well, we know menopause is a natural process, right? But you feel like there are ways that to mitigate the unpleasantness of the process with nutrition and diet and lifestyle practices?
Absolutely. And looking at adrenal dysfunction, because the adrenals produce about 30% of our estrogen and progesterone prior to menopause, 50% of it post-menopause. And if the adrenals are really preoccupied with production of cortisol, they produce the sex hormones, which is what's crucial for women, especially in perimenopause.
That's really interesting. And of course, why are the adrenals struggling? Because of stress.
Hands down, hands down. And what's so interesting is that if you have someone, even younger years with PMS, if they have tons of stress, cholesterol makes the sex hormones, and if we have to have cortisol, so it's a life-threatening disorder if we don't. So cholesterol makes cortisol,
Mhm.
and then they don't have enough progesterone, they don't have enough testosterone, they don't have a sex drive, and they're kind of wondering why. Guess what? We're back to the stress issue again.
What do you feel? What do you? So I'm trying to frame this question right. What are the most common and effective changes that you see or encourage women to make going through? Obviously, there's individualized protocols, but the generalized improvement protocols, right? That are sort of blanket. Like most women in menopause should be doing these things. Like what does that look like?
Food. Food is the most powerful thing we have, changing one's diet. A lot of time, estrogen is an anti-inflammatory,
Mm-hmm.
and we see the risk of heart disease going up about 21% in menopause. So making lifestyle changes, getting away from sugar, using perhaps less grains if you're predisposed to diabetes, and having more good quality proteins, doing more of a Mediterranean diet, avocado and olives, and having really healthy fats, coconut butter, coconut oils. That makes a gigantic change, but also looking at one's stress. Menopause is a journey of self-discovery. Who am I? What am I going to be like in the next half of my life? And how do I want to get there? So it's paying attention to those changes as well, and doing that emotional work as well as looking at adrenal dysfunction. Those things make a gigantic difference. And taking time for oneself and exercising and really embracing this notion of, wow, I can go into the second part of my life different. I can transform myself. I don't have to do it the way I did before. And I can become this amazing person even at 50 or 55 or 60. You don't have to be worried that, oh my God, now I'm going to be this ancient person and can't do life anymore.
That's wonderful and encouraging advice, and I think a great maybe a highlight to close on. Marcelle, thank you so much for taking the time to do this.
Absolutely. It's my pleasure.
I'm so excited to get this out. And friends, if you're watching this or if you're listening to the podcast, or we will post the show notes. If you go to chrisbeatcancer.com/podcast, you can find the show notes. There will be a link to them if you're watching on YouTube in the notes there. And I'll put together some of the studies that Marcelle has mentioned in this. And also, where can people find you online?
They can find me at womenswomen.com for now. And maybe I'm also getting a website, marcellepick.com as well. So either one of those places.
Okay, fantastic. Well, again, thanks. This was really fun.
Yes, it was. Take care.
Bye.